Turning now to the opioid crisis. Some Oregon lawmakers are hoping to expand access to Narcan. That's the overdose reversal drug. It's hailed as one of the best tools to prevent deaths from things like fentanyl. Unintentional overdose deaths have nearly tripled over the last 3 years in our state. And if these bills pass, you could start seeing Narcan as often as you see AEDs or defibrillators in businesses, libraries, even schools. Evan Watson explains.
You might need to get used to this. Oregon lawmakers are trying to make opioid reversal drugs, like this Narcan nasal spray, more accessible to just about everyone.
We do want to build infrastructure across the state that allows for people to get access in their communities. So it could be a fire station, it could be a public library, it could be a bar or restaurant.
State Representative Maxine Dexter is one of the co-sponsors on this legislation. It would make naloxone legal to have and to use without a prescription. Oregon would purchase the drugs in bulk for a cheaper price and then offer them at a discount to anyone who wants them on hand.
What everyone needs to know is that there is no danger in giving a person naloxone. If you don't have any opioids in your body, it doesn't do anything to you. There's no side effect or danger.
That includes schools. Across the country, overdose deaths among adolescents more than tripled between 2019 and 2021. These proposed bills would allow teachers and school staff to use naloxone without a parent's permission if they suspect a student might be overdosing.
I have a teenager in high school. I want my school to know that it is appropriate to resuscitate a child without worrying about liability.
Another part of the bill package, it would no longer be against the law to have fentanyl test strips, kits that can tell if there's fentanyl in pills or other substances. Dexter said a police officer asked her to make this change.
Even law enforcement didn't think that it made sense that paraphernalia was criminalized and getting in the way of people being able to make sure that they could be safe.
Dexter says the bills are prepared to pass with bipartisan support, and the public shouldn't be scared to use Narcan if it's available and they believe someone could be overdosing.
A nasal administration is probably the easiest way. You literally squirt something up someone's nose, and that's all you need to do. The package has very clear instructions. It's straightforward.
She also expects Oregon to improve its tracking and data collection on fentanyl overdoses, saying the Opioid Settlement Board is working on that now.
Public health changes are always too early or too late. You're never exactly at the right time. So sure, we could have done something sooner, but really what this acknowledges is that we have a lot of work to do. We're leaning in and we're going to take care of our communities as best as we can. And there's going to be more that we should consider. This is just a start.
Evan Watson joins me now. And so if there is someone who has a space and wants to have this available, what's it going to cost them?
So Narcan can be, for just two doses, about $75 to $150, which can be expensive. So it's going to depend on the state's negotiating power and purchasing all this in bulk, and then what they offer that to companies, schools, whoever, businesses, public spaces like that. Maybe that could be as much as free if the state decides to go that route, or maybe just a discounted price. We're going to have to see.
Okay. Is it a done deal yet?
Not done deal just yet. The bills need to be approved, although the lawmakers I talked to, including Representative Dexter, say there's bipartisan support for this. Seems like everyone's on board.
Isn't it amazing that this is the place we've come to now?
Just like you'd see an AED on the wall or any kind of medical device. And this is even a step farther than that when you're looking at just a fentanyl overdose, an opioid overdose, and saying this needs to be widely available. Just shows the state of where we are with these overdose deaths and overdoses.
Right, how widespread it is and how common now.
Yeah, and all age groups too. The young people, 14 to 16, I think State Representative Dexter was telling me the highest growing population for this as well.
So tragic. Well, glad that there is a drug that can reverse that. Thanks a lot, Evan. Appreciate your reporting. So what do you think about having Narcan more widely available? Let us know, will you? Send us an email to thestory@kgw.com or call and leave a voicemail. Our phone number is 503-226-5090.